Hello and welcome to Health Professional Radio. I'm your host, Neal Howard, for this Health Suppliers segment. And in studio today with us is Mr. Stephen Powell. He is the president and CEO of Synensis and co-author of the book, The Patient Survival Handbook. Now, Synensis has helped more than 500 hospitals around the world pursue zero preventable harm by measuring and improving quality and patient safety, eliminating the cost of underperforming processes, and ultimately saving lives. How are you doing today, Stephen?
I'm doing great, Neal. Thanks for having me.
Thank you so much. Now, you're the president and CEO of a company called Synensis. Exactly what does Synensis do in helping hospitals to prevent medical errors?
Well, what we have done is we have leveraged an evidence-based approach to taking the world of high risk and managing that in a way that creates high reliability. And so on an industry like healthcare, we can imagine there's a lot of risk involved in delivering healthcare in our setting. But other industries are great models for being able to manage high risk, like the aviation industry, the nuclear power industry, oil and gas, other industries like even the military. They have very high-risk operations, but yet they do them in a very safe way. Well, we've come to know those organizations as high-reliability organizations. And so we take these principles and we've applied those and integrated those within the healthcare environment to be able to create high-reliability teams. And it's these high-reliability teams that really effectively communicate with one another. They have clear leadership. They use a supporting structure where they have really good backup behaviors with one another. And they really have reduced the hierarchy that are sometimes present in highly professional teams like doctors and nurses, so that communication freely flows along with good information to make proper decisions and actions in the event that a mistake occurs to mitigate and manage the risk to patients each and every day. So that's what we help organizations do. And so some of that is involved in basically uncovering where this risk is in their organization, number one, and then helping to show leaders and team members some simple but tried and true evidence-based practices for using each and every day at the bedside with patients to make care safer in their organization.
Now, you're based here in the United States, is that correct?
That's correct. Our headquarters is in the Atlanta area.
But now you're helping hospitals on a worldwide basis. What type of structure do you have as far as sending representatives from Synensis to other healthcare facilities to offer training and support?
Well, we have a pretty large scale, or building a large scale organization, and been growing over a little bit over a decade that we've been in business. So we're just in our 12th year now. We just finished 11 years, entering our 12th year, and we operate in 17 countries. And so again, we service hospitals, mostly hospitals, but also the ancillary clinic, supporting diagnostic centers, and also long-term care facilities that are associated with hospital systems. And of course, in other countries, we serve the health ministries of health and other governments that are trying to, again, create programs and solutions and capture this information around medical errors and improve upon it to also improve their outcomes and health, because this is a staggering cost to not only the U.S. but other countries as well, preventable medical errors, and we help to reduce some of that, if you will, for no better term. Not only is it harm, and it's horrible to see the impact of preventable medical errors on individual patients and their families, but it's a drain of resources on our health system in quality perspective, and also in waste. Really, things that just didn't have to happen the way they did.
Now, when your team comes into a healthcare facility and they begin basically rebuilding the culture within that establishment as far as communication and leadership is concerned, once the training has been completed and you're satisfied that your team has successfully changed the culture within that hospital. How much support is ongoing after your team leaves?
Well, what happens is in most organizations, when you talk about a culture change, really norms, beliefs, values, you're looking at anywhere from a 2 to 4 year activity, and so there's ongoing coaching. There's also this sense making, continuous monitoring of data,
Mm-hmm.
becoming more sensitive to your data,
Mm-hmm.
and knowing when you might be, in essence, deviating from your proposed actions or your agreed to protocols. So it's similar, again, Neal, to, just monitoring, auditing. So we do some of that to help organizations get that outside perspective. Sometimes we can't see the forest for the trees,
Yeah.
if you will, in our own culture. It takes a third party or an outside independent source to kind of bring our attention to possibly some gaps that we just didn't know existed in our organization. So there's some ongoing auditing, and I also believe that this is not like you just don't get to this place. With what we're seeing is organizations are really trying to go from that being good to being great, as Jim Collins talks about, and being great or being excellent in this area requires continuous improvement.
Now, what are some of the misconceptions that you've run into when you're talking with healthcare professionals, hospital administrators about your services? What are some of the misconceptions that you need to quell?
Yeah, I think the first one is we're not here about doing more with less, to be honest with you, because safety requires some extra layers in your defense system. So we're not typically like where someone's going to come in and cut out a certain number of people or a certain number of redundant steps. Although there are ways that we work within the process redesign, but we want them. That's the first myth, and I think the second one is that there's another myth here. This is not about bad people. This is about bad systems, Neal. So this sort of idea of punishing people for making a mistake really is counterproductive, and we have to stop doing that. And so that's a myth that you don't just have these bad people out there making these mistakes, and it's just the few that are out there. What we found in our work, and it's verified by evidence, is that that many of these incidents, if you substituted the person with an equally qualified person, that what you would find is that they could have made the same mistake that the person made as well.
Now, as we wrap up, where can we get information, possibly, get some of your services going?
Well, absolutely. What we have, the best place is just go to Synensis, SYNENSIS health.com. Synensis really stands for unity. So we're really trying to pull disparate pieces of the improvement puzzle together into really 6 core areas: culture, leaders, teams, learning, implementation, and of course patients. So we've been talking about today, and looking at the whole of an organization and not just the pieces and parts, kind of bringing that together. So synensishealth.com, lots of free resources, information, papers, blogs. And again, if people want to get in touch with us, it's easy to get into contact with us, but also to come on one of our free webinars that we do, where we talk about some of these topics and really start people thinking about that they may in fact relate to some of the issues that they've got going on in their organization, and see that it might be an area that they could find some ways to start improving in their organization as well.
Right. You've been listening to Health Professional Radio's Health Suppliers segment. I'm your host, Neal Howard, and we've been in studio today focusing on Synensis. President and CEO of Synensis, Mr. Stephen Powell, has been in studio today with us talking about his company that has helped more than 500 hospitals around the world pursue zero preventable harm by measuring and improving quality and patient safety, eliminating the cost of underperforming processes, and ultimately, in that effort, saving lives. It's been great talking with you today, Mr. Powell.
Thank you, Neal. Really appreciate the chance to come on your show and talk to you about an important issue, patient safety.
Thank you so much. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.